Hello, I'm Lindsay Sisk. Welcome to the Marriage Challenge podcast, brought to you each month by Care for the Family. I'm delighted to be joined by Will and Lucinda Van Der Hart, who are going to share their personal experiences of facing mental health issues in their relationship, and we'll also discuss how couples can tackle similar challenges. But before we get into all that, let me introduce them. Will and Lucinda have been married for 13 years. Will is the pastoral chaplain at Holy Trinity Brompton Church and a director of the Mind and Soul Foundation. Lucinda is a freelance journalist. Both are authors and have even written a book together on the subject of pregnancy. They have 2 children with 1 more on the way, and they live in central London. Will and Lucinda, welcome. It's great to have you with us.
Thank you.
It's great to be here.
So what we'd love to know first is, how did you two meet and end up getting married?
Well, we met at university. I was a postgraduate and I'd arrived at college and was looking around, hopeful that there might be someone there for me, and I didn't see anyone. Unfortunately, the undergraduates arrived about 3 weeks later, so then Louis walked in the door.
Yes, and I remember we did quite a few fun things, going clubbing together and all sorts of other stuff.
I was trying to stay desperately young.
And then Will ended up manoeuvring things so that he could be my rowing coach, which I never found out about until months later.
Yeah,
so we spent a lot of time rowing together.
Yeah, which is ironic because I'd done a lot of rowing before and came back as a postgraduate, and I was offered the women's first aid to coach, which was a great honour. And I said, "Oh no, I'm not really into women's first aid coaching. I like novice crews," because I happened to know that Louis was in the novice crew. So I wangled it so I could spend some time with her, and then we started dating shortly after that. We got married a couple of years later.
Exactly.
That's fantastic. That sounds a great story. Thank you so much for sharing it.
Pleasure.
So now to look to today's topic, facing mental health issues in your marriage. Now, I know this is something that you've experienced in your relationship. Can you tell us a little bit about that?
Yeah, sure. I was working as a curate, so I'm a priest in the Church of England, and I was working as a curate, which is basically a young training vicar. And I've been working, I'd say, pretty hard for my first year. Lots of young vicars tend to slightly overwork, trying to be all things to all people. And in 2005, I was living just across the road from the Edgware Road tube, and on this one particular morning I took Louis, my wife, across. She was going to Paddington Station, and I walked past Edgware Road Station. When I came back, it was clear that there had been some sort of incident that had gone on there, and I put on my dog collar and I went under the cordon, and it turned out it was the London bombings, 2005. And I got very involved in the response to that, and I opened up a little church hall we had just next to the Edgware tube station, which became the sort of triage centre for the police and the emergency services. And so I got really embroiled in this very, very intensive and very, very distressing situation it was 5 days, but certainly it was very intensive for the first sort of 24 hours. And we were visited by the Chief Commissioner of Police, and we won a couple of awards and all these sort of things, which all felt very fraudulent to me at the time, because I was sort of thinking, well, what have I contributed? And I'd say my mental health as a response to that started to deteriorate. Following the London bombings, I felt very anxious, slightly insulated from other people, a little bit afraid, a little bit. I was quite quiet, and I'm quite an extrovert. I remember I went into myself a little bit, and I was struggling to kind of process these kind of issues.
Yeah, well, I think it took a few months, didn't it? And sort of after the incident, before your anxiety really kicked in, it was almost like a lag period, like post-traumatic stress. And then you started to become very anxious and needed to take some time off work. Kind of had enforced time off, didn't we?
Yeah.
And then it became a really difficult season for you.
Yeah. I remember I was at Freshers' Fair. I sort of struggled through the summer. That was in July, and struggled through August and September, and then I came back to sort of Freshers' Fair. I think we'd been away for a bit over the summer, so I felt pretty terrible at that point. And I remember calling Louis and saying, something's wrong with me. Like, I don't feel right. I felt sort of disconnected. You call it now dispersonalized, where you feel like the world, you're sort of looking through a glass at the world rather than actually being in the world. I kept having a racing heartbeat and very sweaty kind of palms, and I felt very cold even though it was very hot. So lots of strange kind of symptoms. And Louis came out to this Freshers' Fair, and I kind of made my apologies and I left. And I remember sitting in a cafe with her and sort of I think she was quite confused and anxious about what I was trying to explain, and I just had no reference for what I was feeling, but I knew it wasn't right, and I knew it was something that was going on in my head.
So I found that Will just wanted to talk and talk about what he was going through, which wasn't necessarily very characteristic of him. He was starting to experience things like we were on a taxi journey, having seen some friends, and I remember asking him why he was shaking so much. And we didn't quite know what was going on with some of the symptoms that he was experiencing and some of the feelings. And so, my instinct was, we need to go and see a GP, and let's try and do that together so I can be part of the conversation, and so that we can start to unravel what's going on.
And what specific challenge did it pose to your relationship, and how do you think it affected you as a couple going through these issues?
I think it had this impact on our relationship where I found myself stepping into much more of a kind of solid, secure kind of role than before, whereas traditionally in our relationship I'd been a bit more the up-down emotional kind of character, and Will had been the steady, constant person. And I really felt that need to be the constant one for him, and to almost be the sort of more of the safe place in the relationship. And that was a new thing for us, and actually was a really good thing, wasn't it? Because I think it brought more equality to our relationship. And I think Will realised that I could do that, and it lifted off a sense of pressure that he had to be sorted out.
I think that's right. I mean, I'm 5 years older than Louis, and we met when Lou was 19 and I was 24. So we were quite young. We got married, a couple of years after that. So we were quite young when we got married anyway. And I'd taken this sort of responsibility of being a husband very, very seriously, and trying to make everything as sort of safe and secure as possible. And Lou had struggled a little bit with her emotions prior to us even getting together. So I'd kind of tried to be very sort of steady and constant. And I think that actually created a bit of imbalance in our relationship, almost that I'd assumed a role of being the leader and being the sort of confident one, and Louis was leaning on me. What I realised when I went through this really difficult episode of anxiety was that actually she was incredibly strong. In many ways she was stronger than I was. What happened was, rather than me being the leader in our relationship and her being sort of the person who was leaning on me, there was a great mutuality that came about in our relationship, which has never gone away. So even now, 11 years after that experience, I feel like our relationship is incredibly balanced and equal in terms of responsibility. And I always look to Lou with great sort of admiration, really, for the way she dealt with that, because there's a lot of stigma attached to mental health, and when you're young, you think everything is going to be rosy and better and easy, and then suddenly you realise, actually, I'm married to someone who is potentially quite vulnerable. Now, my circumstances were that I actually made a very complete recovery from that acute anxiety. I'd say I still have a tendency to fall towards worry, as particularly when I'm stressed, but my recovery has been quite a straightforward one. What we've now done is started working with lots and lots of people around the country where there might be a more serious and enduring diagnosis, and their marriage is difficult because it's impacted by mental health issues on a daily basis, not just on an episodic level. But you do realise how much you depend on one another, and a good, strong marriage is really supportive of good mental health.
You say you've made a sort of complete recovery. What did it take for you to kind of get through it, as individually and as a couple?
Well, I think when you're diagnosed with an anxiety disorder, there's no sort of point which you're completely signed off, but you have a sensitivity towards anxiety. And obviously circumstances, in my experience with the London bombings, conspired to make that particularly stressful period of my life. I would say your emotional health is much more like a garden. You have to keep on weeding if you don't want the garden to be overwhelmed with weeds. So I have to constantly work on my anxiety and my stress levels, and I do things like I run most days of the week, and I eat well, I sleep well, I talk a lot, and I have a supervisor who I did have quite an extended period of psychotherapy to help me come to terms with all this. But the kind of the real strength of my recovery, I think, is based in our relationship. And you can have, I had needed medication for a short time, I needed therapy for a short time, but the security of our relationship was one thing that goes on as a sort of healing strength to me. And actually, the security and love of a marriage is something that's incredibly healing. And for me, was an absolute lifeline. I mean, Louie was amazing how she listened and listened and listened as I kind of talked my way and walked my way out. We used to just spend hours, didn't we? Louie used to come home from work when I was signed off work, and she would come home from work and we would just walk for about 2 hours, and I would just talk about stuff. And we did that for a long time. I think we walked a few miles over a few months, and that was really a core part of my recovery.
Lucinda, you've been obviously in a supporting role when Will was going through these difficult times. What advice would you give to someone listening who's perhaps trying to care for their partner going through a difficult time with mental health issues?
I think look after yourself as well, and you'll be spending a lot of time thinking about someone else's needs and their problems and trying to meet those or do whatever you can to meet those. But just to stress the importance of having compassion on yourself, being patient with yourself, and finding some other friends or family members who you trust that you can talk to, and so that at times you're able to step away from the burden of the situation and offload and talk and get the support that you need so that you can be the best that you can for your other half.
Finally, before we finish, what advice and encouragement would you give to other couples who are facing similar situations?
Our encouragement really is to try and escape some of the stigma relating to mental health, because you need to share this stuff with your partner. And actually, if your partner was diagnosed with cancer, you would research cancer until you knew everything that you could find out about cancer. The difficulty with mental health is because it was perceived as a weakness, the partner who's struggling might desperately try and hide the fact that they're struggling until they're really in a difficult place. And that's kind of our encouragement, is kind of get educated about mental health, disclose to your partner how you're feeling, even if you're not clinically unwell, be honest, be real, and kind of go through those struggles together, and actually you become resilient as a couple as you share those struggles and as you work through them and support one another in them.
I would certainly say I've realised again that old adage is true: never judge a book by its cover, and it doesn't matter from what background, status, wealth, experience somebody comes from. They might look like they've got it all together, but on a deeper level there can be all sorts of things going on, and that's okay.
Yeah, I think mental health is it's never boundaried by what you have or even how happy your marriage is. You can have the best marriage in the world and still be struggling with a mental health problem, just like you can have the best marriage in the world and still get struck down with some sort of physical ailment. And there's no doubt that some mental health conditions do create really significant problems within marriages, but nearly all mental health conditions are also highly treatable. The right medications are available now, and actually the outlook for most people even with a serious and enduring mental health problem is actually really positive. We know a number of couples who live very happily in marriages where they're quite significant diagnoses, but actually together they are a fantastic couple and are making great strides forward together and have an amazing relationship.
Will and Lucinda, thank you so much for sharing with us. Before we finish, a reminder that you can sign up on the Care for the Family website to receive more news and updates from this podcast. When you do, you automatically receive a 20% discount off your next purchase from the Care for the Family shop, so do check that out. That's all from this episode. It just leaves me to say thank you, Will and Lucinda, for joining us, and we look forward to tackling another marriage challenge next time. Goodbye.
You have been listening to the Marriage Challenge podcast. For further information about our courses, resources and events, visit us at www.careforthefamily.org.uk.